I started out in medicine, and when I was doing my clinical work in the hospital, I decided that we should really be doing prevention rather than trying to pick up all the pieces. And so I went back and studied public health, and it seemed to me that one critical area that was really neglected was population, family planning, and reproductive health. And the thing that's been interesting to me is that rapid population growth, which happened after World War II, was based on rapidly declining death rates with very little work in prevention of unwanted or unintended fertility. And so it seemed like this was a huge missing element in our work, and one that I could help fill a bit. And it's one thing that's been very impressive is how rapidly fertility can decline once we actually make good services and information available. And there are many, many examples of developing countries that have turned the corner in the demographic transition from high birth rates and high death rates down to low death rates and low birth rates as well. The unfortunate thing that I guess we have learned is that the resources for this kind of work are not nearly as great as they need to be. But family planning programs really are not very expensive. If we had, $2 to $3 per capita in developing countries, that would probably be enough. I mean, my estimate is that family planning would take about $15 billion a year to make it universally available. The role of information is particularly important in developing countries. They are, relatively speaking, starved for information, and they have weaker means to get it. I mean, in the US and other developed countries, we're constantly bombarded with information, much more than you could possibly absorb, and you can pick and choose. I mean, if you want to just watch country music on TV all day, you could do that. But zeroing in on issues that relate to reproductive health and family planning is something that's very difficult in developing countries. And I think electronic media have the potential for changing that. Certainly, one of the key drawbacks of written or computer-based information systems is you can read it, you can absorb something, but then you're left with questions. And what we really need is a way to quickly get those addressed. You think about the support system that, say, Apple Computer has, or some other software program. You bought your new computer and then you're stuck on something. You need to call up that helpline. The equivalent of a helpline would be, I think, very helpful for people working in the population field. But when you get right down to the nuts and bolts of running programs, I think lack of access is the #1 problem. Convenient access and consistency of access. All over the world, there are clinics suffering from shortages of contraceptives. And if you've gone back to get your refill of pills, for example, and they're out, and you've walked 5 kilometers to get there, you may not want to come back. Another big problem, of course, is lack of variety of contraceptives. We know from experience that when you try to do family planning with 1 or 2 methods, that's just not enough. The successful programs offer a variety of methods. They offer them as much as possible through non-clinical outlets. They make them affordable. This is a recipe for success: good information and services. I guess one piece of advice I would give to somebody just starting out into the field is to make your decisions science-based as much as possible. And it's important to invest a certain amount of your resources into fact-finding, evaluation, the science of what you're doing. The family planning field has benefited tremendously from that. That's one reason it's been successful. We have studied what works and what doesn't work. And this can be done at the level of an individual clinic, but it's also something that can be done at the national level. And so you continuously modify your policies and programs based on feedback from what is successful in the field. The other thing I would advise is to get as strong a scientific basis for your work as possible. So be a good reader, I guess, would be one piece of advice. Don't just go on there blind. I know it's difficult to find time to do that, to keep up with what's new in the field, but we know a lot about this field. We know a lot about what works, and building on that is going to make you much more successful.